It is Therapy Thursday, a day where we answer your questions with the help of our friend, Dr. Brenda Lloyd Jones from the University of Oklahoma. Brenda, let's jump right in on a Thursday. This question comes from Melvin. Melvin says there has been a lot of talk recently about generational trauma. Does this mean that if my parents have experienced trauma in the past, I will as well?
So the short answer is not necessarily. However, let's start with trauma. Trauma is a psychological and emotional response to a deeply distressing event. And it usually is centered on something that has one fearful and they have a sense of helplessness. So, for example, a child may have experienced trauma from a parent, for example, a parent's trauma, and have developed anxiety and depression around it. But siblings in the same family may have a totally different response to that trauma of a parent. So it affects people differently. It doesn't happen to everybody necessarily. And what is the heart of this matter is that there are mental health professionals who can assist. There are also resources that you can read about to better understand if you are experiencing generational trauma.
So is there a way that maybe you could stop that cycle? You can't necessarily push a family member to go seek therapy, but what can you do for yourself and to perhaps make it better for, say, your children?
Oh, absolutely. So talking about what happened in age-appropriate terms, certainly looking at and going to therapy together, because the therapist is trained in that area and can give you exercises, can actually give you homework, and give you ideas around disrupting this cycle of fear and helplessness.
Well, and getting tools also to help process that and how to maybe move past some of that trauma, that perceived threat that's maybe been ingrained since you were a young child, kind of forming new habits maybe?
Yes, and developing coping skills. Yeah. Coping skills are critical in this particular area, and you'd be surprised how well those types of tools can help.
Very good. Dr. Brenda Lloyd Jones, thanks for your expertise this afternoon.
My pleasure, Tatum.
If you have a question that you would like for us to consider next week, send us an email to therapythursday@griffin.news.